Welcome back to Empower Indie Podcast. This podcast creates space for honest conversations about health, well-being, and community resources to help people in southwestern North Dakota live healthy, full lives. The Empower Indie Podcast is produced by Women Empowering Women, a nonprofit organization dedicated to connecting, supporting, and educating women to help them become the best versions of themselves. To become a member or learn more, visit wewnetwork.org. Welcome to the Empower ND podcast. Today we're talking about measles and why it's still important for parents to stay informed about this illness. We'll cover how measles spreads and the symptoms parents should watch for to help keep their kids and community healthy. Let's start the conversation. Introduce yourself and just kind of tell us what you do.
My name is Chantel Clem, and I am the infection preventionist for CHI St. Alexius in Dickinson. My background is in biology and chemistry, and then I also have an MBA with healthcare management focus.
Yeah, awesome. Well, thank you for coming on.
Yes.
Okay, so we'll just kind of dive right in. So measles, for someone who's never seen measles, what is it?
So measles is actually a respiratory disease, which is a common misconception. The rash actually shows up about 4 days after the fever starts. So it's really going to start as fever, runny nose, sore throat, pretty common respiratory illness. And you've actually diagnosed measles in your healthcare career.
Yeah, so recently, before, most providers had never seen measles in their entire careers. So I actually have diagnosed it now, which was really interesting to be able to actually see it and see the severity and just see the vast difference in severity that each patient has too. Some people don't have any symptoms and some people have severe symptoms. So it's just a very different reaction for each person.
Yeah, the watery eyes, red eyes, they're called Koplik spots. They are spots that end up in your throat. Probably look similar to strep. I wouldn't know. I haven't seen them. Similar to strep?
Yeah, so kind of like whitish spots.
Yeah. Yeah, so those spots show up, and then after it's, you think you have probably a cold, that rash starts showing up, starts pretty classic, starting at your head, going down to your toes, spreads through your body that way. And that is probably where people get exposed without knowing that they were even, sick with measles, is because they think they have a cold, and then all of a sudden this rash shows up. And when that classic rash shows up, I think everybody knows.
Right. And then how is it kind of different than other childhood diseases and how contagious is it?
Measles is really contagious. It's an airborne disease. So the infectious material rides on particles rather than big droplets. So thinking about sneezing versus just talking. As you're talking, there's water coming out of your mouth. We probably don't like to think about that, but it can really even spread on the droplets that are coming out of your mouth while you're speaking. So it's just that much more virulent. And it just takes a little bit of exposure to become sick. So that's why when you see these in the news, we see these long lists of places where you potentially were exposed, and it's such a long time frame. And the reason that is because really just entering that room and speaking to somebody, walking around, breathing, you are introducing potentially some virulent material, and it hangs around in the air for so much longer versus, when it's on a droplet that you're sneezing out, that's heavy, it falls right to the ground or sticks onto whatever is, that next place that it encounters, where these can just float in the air, and it can get you sick just that much quicker.
Yeah, so I kind of explain it to patients as like when you go outside and you can see the fog in the air, if you imagine like every single bit of that fog is potentially spreading somewhere and then stays in the air for a while, and that fog doesn't just disappear right away when you walk away, like it's still there. So my oldest son did a science experiment with this at one point during COVID, actually, where he put a mask on and we videoed while he was like purposely coughing forcefully to see how far it spread, because you can see the fog, from the air. And when the mask was on, you could see it was a little bit shortened, but it still goes, it still went through. And so just being able to visually see that and think about it that way kind of helps people to understand like where that droplet is going.
Yeah, and like I said, it really just takes so little bit and just any interaction within those spaces, then, they figure about 2 hours for air exchanges. There's all these fancy formulas that you can look up. It's very well studied in that respect, but they go by how many air exchanges they would need in a space for that space to be effectively clean of virulent material. So that's why when you leave somewhere, it's 2 hours after when you leave. So that's, I think, one of the things that gets people stuck is, you get these big laundry lists of potential exposures, and they're so long, and you're thinking, well, how could you possibly be at a Starbucks for that long?
Right.
But it's, factoring in how that air moves within that facility and kind of just putting that potentially for 2 hours. It was hanging around in
Right.
there.
So if parents think that their child was exposed, then what should they do?
So if parents think their children were exposed, one thing you can do is go back and check their vaccination records, make sure that they have that MMR vaccine on board. For areas where you're exhibiting outbreaks, so there's some counties right now in North Dakota that they are exhibiting outbreak. They make special rules where you can get an emergency MMR vaccine between 6 and 12 months. So getting that on board because it is 93+% effective even with one dose. After that 12 months, maybe you skip that 12-month appointment and you didn't get your MMR vaccine. If you want to get it prophylactically, you can get an MMR vaccine prophylaxis within 72 hours of that exposure, or there's the option for measles immune globulin, which you can get for up to 7 days, and that hopefully reduces the severity of disease if you do end up contracting disease.
What do parents need to do to just manage symptoms at home if they do get exposure and they start to exhibit symptoms?
So really symptom tracking almost for, any of these diseases that we're talking about. Varicella is another one, childhood illness, vaccine preventable, that you can symptom track if you are exposed to somebody who has chickenpox or shingles. And in this case, it's the same thing. So you would want to just make sure that you're checking your child's temperature, watching for those spots to show up in their throat, runny nose, watery eyes, really just kind of pinpointing, making sure there's no change in their kiddo. So a lot of times people, blame it on allergies, or we do have allergies, and you get a little high strung about it. But if you truly do think that you are exposed and you are exhibiting those symptoms, you should start staying home, start tracking your symptoms to really pin down that symptom onset date. The less interactive you are in the community, the less chances it is to spread. And that, I think, is a big takeaway, especially if you know that you might be susceptible to that disease, is, if you've had an exposure, really doing that symptom watching and trying to stay out of crowded places, places where there's going to be infants, especially those, 1 to 6 months who can't be vaccinated. The elderly, people who would potentially have a harder time with that disease, making sure that we're not hanging out in those spaces when we potentially were exposed.
And I know that some providers and clinics and different, places that you can go have different protocols for trying to just stay really healthy prior to increasing vitamin A and being able to do those kind of things so that they hopefully don't contract measles, and besides just staying home.
Yeah, if you are exhibiting those symptoms, providers are always going to want you to call first, just so they have a heads up, because there is a PPE protocol that we want to make sure, one, we protect other people in our clinics, two, to make sure that we protect ourselves as clinicians, because if we're sick, we can't take care of everybody else. So really just making sure we call ahead and give a good background of, these are the symptoms I'm having, these are the concerns I've had. There is a vitamin A protocol that you can work with your provider of initiating if that is something that your body needs, or that your particular health situation needs. Measles is known to reduce the amount of vitamin A. I think that's why that they have those vitamin A protocols. Is that's one of the things that measles impacts just normal vitamin A balance in your body.
Right. And I think that something that is a takeaway from just seeing measles now is how severe the watery eyes really is. It's not just allergy type symptoms. It's like severe running of the eyes, and it's really noticeable. So if your child has that, I think that that's something that is really good to know, is that it's not going to be questionable. Like if they have it, you'll know.
Yeah, and that shows up before that rash does.
Right.
So that could be like that classic symptom that before you're even hitting rash, you've been exposed, you've been in, traveling, and all of a sudden your child has these really watery eyes. Um, Probably just best to keep them home, contact your provider, and get that testing done right away to reduce the amount of spread.
And I think that making sure that parents understand that anytime you're sick, staying home is probably the best option.
Yes, fever-free, 24 hours with no fever-reducing medication is kind of the gold standard. I know it's tough. We're both working moms.
Mhm.
Not to be like, oh, you're okay. Try to limp it out. Really, and it kind of goes for us too as clinicians.
Right.
Staying home when we aren't feeling well is really the best
And I think
practice.
that just protects, other people, medically fragile people, our community, making sure that, it used to be, especially before COVID, I think it was a more prevalent that you went to work sick. Like that was just expected of you to, to get through the day. And now
Mhm.
that's not expected. And we've actually learned that we're probably really spreading a lot of things we probably shouldn't spread just by going to work sick.
Yes, yes, absolutely. And it's not just work, it's the grocery store.
Mhm.
Um, all the places that we go when we're not feeling well. If you can send somebody, it's better to just send somebody behind you. And if not, washing your hands. Washing your hands is the simplest way to prevent the spread of infection. So if you're not feeling good and you know that you have to go out and about to, grab yourself some Pedialyte or some Tylenol, making sure that you clean your hands on your way in, keep the things that you're touching to a minimum, clean
Right.
your hands on the way out.
So if parents are going to travel soon, especially with knowing that there's certain areas in our state that have an outbreak, what is something that they could do to try and kind of track that and know where they're traveling and what their risk is?
The North Dakota Department of Health website has a really great tracker and information dashboard about virtually everything. Even through flu season, you can see where flu is spiking, what the percent positivity of the testing is. It's actually really kind of cool to see what's happening in and around our state. But the measles tracker, if you go to the Department of Health and go to their measles website, they have a ton of information about stopping the spread, about symptom watch, and then they do have where outbreaks are occurring, when the last positive was, how many cases are there, and with that, you can see exactly where the potential exposures would be. So, um, really just keeping informed. And then as you're traveling out of state, the CDC website has a measles tracker as well. So if you're planning on taking a vacation, it might not be a bad time to look and see what's going on where you're headed, especially if you know
Right.
you have little people or unvaccinated or medically fragile people in your home. It might not be the best time to travel to certain locations.
Right. Or if you're visiting someone that's medically fragile, then you can kind of weigh all of your options and risk.
Yes.
So, what is something, just to kind of clear some confusion up, that most parents misunderstand about measles?
I think one thing that has kind of popped up is that there are a lot of look-alike illnesses that circulate within little people that get people a little jumpy. So, like roseola is another one that has a very similar presentation, a very similar rash, but not caused by the same virus. Fifth's disease, that's another one
Mm-hmm.
that their cheeks get really red, they have fever, those sorts of, same symptoms. And then they do get a rash, but it's a little different looking rash.
Right.
Um,
And just knowing that the rash is the last thing that happens with measles.
right.
It's not the first thing. It's not, they would have been sick for a couple days before they get this rash.
Yep. Yep. Day 4 to 7 is when that rash really shows up. But when you look online, what you're seeing is typically pictures of the rash. You're not seeing the
Right.
pictures of all the other things that come in
Even though the
between.
rash is like the last thing, and it's kind of when you're starting to actually feel better, is when you get the rash.
Yeah. And just knowing even too that you are contagious for up to 10 days after, when you're thinking about how the symptoms come on, day 1 through 4 is where you're going to have those real classic respiratory symptoms of fever, runny nose, sore throat, the spots in your throat, the watery eyes. And then after that rash comes, yeah, you're really at the tail end of your illness. But that's typically what people, correlate together is the rash
Right.
and measles.
Okay, so what is something that we can talk about for um, the difference between light skin and dark skin when the rash does appear?
Yeah, so when you're seeing this rash on lighter toned skin, it's gonna be red, it's gonna look angry. When you're seeing it on, darker skin or people of color, it's gonna be more purple, gray, hyperpigmented. It's not gonna be the classic red, angry skin that, again, you kind of associate with measles when you're looking it up online. So, really just even understanding, and kind of just knowing your kid's skin and knowing their texture, knowing things that are out of the ordinary. Because again, if you're not really thinking measles because your child has some sort of respiratory illness, you might not actually catch that rash as quickly as, people that have lighter skin tones might. So, really just keeping in check, especially when your kids are not feeling well, you potentially might have been exposed, you're traveling around, just keeping an eye on that, or if they have hyperpigmented spots that are starting on their head and kind of look like they're traveling down, that would be another quick indicator,
Mhm.
to get that checked out.
Thank you. Okay, so thank you for sharing your time, insight, and expertise with us today. Thank you to our listeners for spending this time with us and being part of these important conversations. This episode was made possible by a grant through the North Dakota Department of Health and Human Services. Until next time, stay informed, stay empowered, and we'll see you on the next Empower ND podcast.